Welcome to Hope for Med.
Hope for Med.
Hi, everyone. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Madeline Sutton. She is an OB-GYN physician working in Atlanta, Georgia. Welcome to the show.
Thank you so much, Dr. JB. I'm so excited to be here.
Yes, and I am so excited to hear your story. So let's start from the beginning. Why did you choose a career in medicine?
Goodness, it goes back a long time. So first, let me formally introduce myself. So I'm Dr. Madeline. I'm a board certified OB-GYN, author, speaker, former CDC scientist. And I love working with women, whether they're busy inside of the home or busy outside of the home. I love working with women to help make sure they have accurate GYN information and also access to birth control options, things that can help give them more freedom and control. And so to help women do those things, I have a platform through Dr. Madeline MD on social media and a book that I recently published last year called In Control. And I'm just really trying to get as much information out there to women as possible. So again, thank you for having me. So where did my journey start? So I'm originally from Harlem, New York, born and raised. And, you know, something about growing up where I grew up, I saw a lot of things early on that I didn't really understand were issues related to health equity. And so early on, I thought that I had an interest in health and sciences. I knew I loved science. I knew I loved math. I would intermittently get my healthcare at an emergency room. You know, the way the system is, if my mom was working all day long, that was really her outlet to be able to get us checked for things that were going on, was to go to the emergency room.
Yep.
But there was one time when I was 8 years old, and there was a new Black pediatrician in Harlem. His name was Dr. Thomas Patrick. And my mom took me to see him. It was for something small, like getting my ears pierced. This was before everyone got their ears pierced in the malls. But there was something so powerful, I thought, about seeing this young brother who was in Harlem working as a pediatrician. It just stuck in my mind. I think that was kind of the first seed that I had, like, wow, you know, someone looks like me and maybe this is something that I can do. And let me fast forward to 8th grade when I was about 13 years old. I presented to Columbia Presbyterian emergency room. My mom, you know, had to take me in. I had low abdominal pain. I had fever. They diagnosed me with appendicitis. They took me to the OR, took out my appendix, and post-op day 1, I'm there on the floor. And I thought it was the coolest thing. This surgeon, who happened to be a white male, thought it was cool to kind of bring me my appendix in a cup from the pathology lab and show it to me. And I thought, that is the coolest thing ever. Like, he took that out of me and helped me feel better. And so I think that was the first time I started thinking about not only medicine as a health career, but also, you know, giving some thought process to doing something that might involve surgery. So I went to Bronx Science in New York City, which is a high school that specializes in like science and math, and went on to Georgetown undergrad, where I was a psychology pre-med major. And then went on to Columbia University for both my MD and my MPH degrees. And for me, you know, when I was starting at Columbia, it was really great. They had this program whereby they invited all of the accepted medical students to come and find out some more about the MPH degree. You know, when I heard them trying to sell us on this program, it was 1 week. They said, come away with us for 1 week. We'll pay for your housing and everything, and we'll give you a crash course in some public health, and you'll get some credits. And I thought, how ridiculous is that? Of course, we're going to learn public health in medical school, you know? But what I didn't learn until I went to do that 1 week and was exposed to the MPH degree, what I learned is that what I was going to get in medical school was very individualistic, how to take care of the individual patient. And public health was going to give me more of a community and broader public health perspective. And so I was sold. I signed on the dotted line and I went ahead and got my joint degrees. And I met some fabulous people when I was having lectures, including a Black female OB-GYN who also had her MPH, who was doing exactly the type of work that I wanted to do, taking care of women who were living with HIV. And but also being very scientifically strong and publishing and doing clinical work. And so, it was an interesting road because I was doing it as a first generation person, but I absolutely was able to be exposed to all the different opportunities that I needed to be successful. And once I was exposed to OB-GYN, I was like, oh, that's it. That has everything. It has like advocacy. It has taking care of women pregnant. It has taken care of women when they're not pregnant. It has surgery. It has delivering babies. So yeah, I thought it was a great fit.
That's so amazing. And you've been an OB-GYN for how long now?
I've been an OB-GYN board certified since 2000. Finished residency in 1997. So I've been doing this a long time.
Nice.
I still love it. I still love taking care of women.
And so where did the CDC come into play?
Great question. So when I was finishing residency in 1997, so like I said, when I finished at Columbia, I had both my MD and my MPH degrees, and I went straight into residency in Newark, New Jersey. But when I was doing residency, OB-GYN has kind of three factions that you could go into. You could do high risk OB, you could do GYN oncology, or you could do reproductive endocrinology and infertility. And I wasn't really interested in any of those in terms of additional fellowship training. But what I was interested in was getting more hands-on public health training. And so when I was, we have our grand rounds in residency. So after residency, during residency, I was able to be a part of a lecture grand rounds where Dr. Diane Rowley came. Mm-hmm. She's a board certified pediatrician, and she was talking with us about what was going on in terms of infant mortality and health disparities and all of that. But she also happened to mention at the end a fellowship opportunity that the CDC had called EIS, or Epidemic Intelligence Service Fellowship. And so I was so excited because I thought that's it. That would allow me to kind of dive a little bit more into the world of public health. Yeah. So I applied to the EIS fellowship at CDC. I was accepted, and I went there with the idea of doing the 2-year fellowship and coming back home to New York because I love New York as a native New Yorker. Mm-hmm. And it translated into a 21.5-year career at CDC. I absolutely loved the work that I was doing. I worked in the division of STD prevention and the division of HIV/AIDS prevention. And I always had a passion for HIV prevention, I think, because of what I was seeing in the mid 80s as the epidemic was really starting in this country. It was first recognized in 1981 when CDC first published the report about the 5 men in Los Angeles and what we called initially AIDS. And it was always a passion of mine to learn as much as possible about HIV and to work really hard on prevention. And so I ended up staying a long time. When I was there at CDC, my last 12 years, I was able to be in charge of a program that, it was like my dream job. I was mentoring mostly Black and Hispanic early career scientists who were doing community level HIV prevention research. And I was making sure that funding was targeted specifically to them in the work that they were doing. And it was amazing. It was a great ride. So I did enjoy. That's how I ended up at CDC. I did continue to do some part-time clinical work while I was there, just to make sure I didn't lose my skills. Mm-hmm. But I absolutely loved my time at CDC, and I retired in 2019.
Yeah, and that's how you ended up in Georgia.
Yes, that's how I ended up in Georgia. Mm-hmm.
So during all of that time, you said that you were able to continue doing some clinical work while you were working at the CDC. So tell me, how did you juggle the two?
So, with OB, one of the things we have to do, so our board certification process is 2 parts. We have written and we have the oral. Mm-hmm. So one of the things, if you decide you're going to maintain your clinical expertise, it's really important that you get that board certification. So I was able to become a faculty member at Morehouse School of Medicine. Grady Hospital, which is kind of like the safety net hospital in Metro Atlanta, mm-hmm. houses 2 medical schools, Morehouse School of Medicine and Emory University School of Medicine. And I really wanted to spend some time. I'd done most of my training at PWI, so I really wanted to focus on working and being a part of an HBCU unit. So I got a faculty appointment at Morehouse, and I was able to, over the course of the first few years where I was collecting boards for board certification, I was able to, work a couple of times every month. It wasn't really intense. It's certainly not private practice. And throughout the years of my time at CDC, even after I got my boards and everything, I just maintained that working at Grady Hospital, working with the residents, the med students, for different amounts of time over the course that I was there at CDC, but always consistently being present. And then there was one block of time when I worked probably for about 9 years at a federally qualified health center that was in my community, also seeing patients in the clinic there and working at the hospital where those patients delivered. So I was really fortunate to be able to juggle and do the things that I loved, even while I was at CDC.
And so during this long career that you've had in medicine, have you ever experienced any symptoms of burnout?
Oh, absolutely, Dr. JB. So, I mean, I probably still feel them now, although I think right now feeling burnout is for a different reason. I think just trying to navigate through 2 years of this pandemic has really been something I would have never even imagined. Yeah. But I would say my biggest period of burnout had to be, so I'm a mother of 3 wonderful sons. My sons now are 22, 21, and 15. But I got to tell you, Dr. JB, when they were little, when I had my first 2 are 17 and a half months apart. And there were times when I just couldn't even figure out if I was coming or going. Yeah. I was like, and even when you're partnered, at that time I'm married to my husband. But even when you're partnered, there's still this sense of, as a mom, I still got to get all this done. Mom and aunties, especially when you're first generation, it's not something where it's even discussed or definitely not accepted that you would like parse out certain responsibilities to others. So I probably spent the first 4 or 5 years of being a mom, working at CDC, part-time clinical work at Grady Hospital, dropping off the boys at school, picking up the boys from school. And absolutely, my husband at the time was doing his part as part of that process, especially when it came to, like weekends, taking the boys to soccer practice or something like that. But it's still, I think as a mom, you feel that you have to do it all or else you're not complete. Now, the beautiful thing about having sister friends, I have a really good, she's also she's a physician here, also at Emory, and we've known each other since we were teenagers back in New York City. Mm-hmm. But the beautiful thing about having a really good sister friend is they'll talk to you in a way where they give you a whole new perspective. Because I remember talking to her one day and I was like, oh my God, I'm not gonna make it, it's too much. I feel like there's so much going on. She's like, first of all, why are you still trying to clean your home? Hire somebody. First of all, why are you still trying to cook 3-4 times during the week? Buy some food that's already cooked. It was like those little things that I thought, as a Black woman, I can't, I'm not supposed to get this type of help, Yeah. But I would say definitely the burnout was heaviest when my children were youngest. And as they got older, I mean, it was just, I could feel the layers coming off little by little as they got older. And although there's still burnout with what we do, working in the hospital setting, the clinic setting, especially now, I think I manage it a little bit better because I've gotten a little bit older and wiser. And I absolutely believe in seeking and receiving help. Yeah. And I also believe in scheduling self-care time. I got very determined when it came time to schedule vacations away, whether it was solo or with sister friends, making sure I took time off to spend with friends who bring me joy and who have good energy. And so I definitely got more intentional about that, the older and wiser I got.
Yeah. So when during your career did you start becoming very intentional about some of those things in terms of self-care?
I would say maybe about midway through my career, because I spent the first part of my career really thinking that I was supposed to more effectively and efficiently juggle it all. Mm. That's just what I thought. And somewhere around midway, a couple of things started happening. Things would slip through the cracks. or I'd have another conversation with a sister friend. I think as my sons got older and began to be able to be more self-sufficient, as I became more self-empowered in terms of navigating more of my spaces with my husband at the time, and as I became better at doing my job with less effort,
Yeah.
doing my job smarter, I think I began to get much more intentional about, looking at the calendar and saying, you know what, I'm going to schedule this weekend off in the next month or two so that I can, either be home and do nothing or travel somewhere nice and just like regroup and spend some time just taking deep inhales. And so yeah, it took me about halfway through my career, and I think, like we said, so I've been doing this, about 25 years or so. I didn't really figure it out till somewhere around year 12 or 13.
And I wonder why is that it took a while before, realizing the importance of self-care.
I think there are many reasons. One has to do with how it's modeled for us. Like when I was in med school and residency, I never saw any female attending complain, look concerned, look stressed. They just looked like they were handling it all.
Yeah.
And so one of the things that happens is that if you don't see it modeled in a certain way, when it's happening differently for you, at least for me, I was thinking, goodness, why can't I get this together?
Yeah, exactly.
So-and-so had it going on. I saw so-and-so and she was never stressed. And then, you realize that if you had taken the time to actually sit down and talk with people always have more going on than what they share.
That's right.
I'm such a big advocate of, especially in the world of sister friends and women, I'm a huge advocate of us talking and sharing what's going on, because you just never know what some other sister is suffering through because she thinks that's the way it's supposed to be done. So I think that's one thing that took me a while to figure out, that my situation was not necessarily unique, but it was happening that people were not discussing it as much. It was also happening. I have many friends who had situations where maybe they had parental or family support kind of move into their unit to be like an in-house and way of helping with the kids or helping with cooking and cleaning. That is huge. It's so huge. It's such a blessing when people have that. Mm-hmm. I would say the other thing that started, well, I think you asked why was it that I didn't understand it sooner? So definitely how it was modeled professionally, but also culturally, what I saw and what I understood within my own family unit. As a Black family with Southern and New York City roots, it was just, and as someone doing this as first generation, I honestly thought that the way to make my family proudest of me was to show them that I was doing it almost effortlessly. Like I'm good, y'all. I'm good. I'm flowing. It's all good. And yes, I made it through medical school. Yes, I'm here working at CDC. I have these 3 wonderful children. It's all good. It's kind of like that face or that front that we put on until you get old or grown enough to realize, you know what? I don't need to do that. I need to be honest with my younger cousin who's now struggling, and I need to sit down and say to her, "It's all good. What do you need?"
Yeah. What you mentioned in terms of, the role modeling and, what's portrayed to us as we're going through our lives, our trainings and whatnot, because that still happens till this day. We all, I always say this over and over again, everybody should just like patent it or whatever, but like, we all go through these, our days, and we're all in our little silo. We're all on our little island, all our own. And we have this smile on our face, and we're walking with our, shoulders back and, and displaying like we have it all together, and in some ways that's good, especially when we're dealing with patients, right? As the physician or the healthcare professional taking care of that patient, we've gone through so much schooling and whatnot. We are supposed to, have it pretty together, or at least exude that while we try to figure it out in the background. But when you're not in front of the patient anymore, right? When you're amongst your peers, that continues. And then you feel like, well, there's something wrong with me, right? Because you know what you're going through. You're not sharing it with your colleague, but you're just looking from the outside. Oh, look at my colleague. They have it together and I don't really have it together. And then you just feel more alone.
Yes, 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 that's absolutely right. You just kind of take for granted that things are what they appear for other people, even when you kind of know that for yourself personally, there's more going on underneath those layers.
Mm-hmm.
And you're right. I think particularly in hospital settings, it's important, it's important that we exude confidence to our patients. So, we wear the persona then. With our peers, it depends on if any of them are our friends outside of that professional circle, and then certainly with our superiors, because especially in the world of medicine, there's something very real about the whole like trickle down impact of working with people who have been doing it for longer than you, and the see one, do one, teach one, and how that kind of plays out when you are wherever you are in the hierarchy of medical care in the hospital system.
Mm-hmm. And the see one, do one, teach one carries over into what we're talking about, right?
Exactly.
Continue exuding this air. Yeah, but in reality, though, we're human beings, right? Like, yes, I'm an emergency medicine physician, but I'll tell you, I'm no hero. Don't give me that title of hero. I'm a human being, and with human emotions, with human feelings, and I think that's really important to be stressed, because I think it's so easy for somehow for us not to really be seen as the humans that we actually are.
Absolutely. In early 2020, when we were in the early stages of the pandemic, I remember having these conversations with my residents a couple of times, because in those early months, it was, I think, the first time for me in 20-something years of being in medicine, the first time I felt that many hospital administrators were not at all concerned about our health and well-being and safety. And so I remember talking with them, and that, especially at the resident level, they were feeling, stressed, and they couldn't believe that so-and-so had said this, and they couldn't believe they didn't have the PPE that they needed. And I told them hands down, if you don't have what you need, you are a human being and you have to protect yourself first. So they either give us what we need, they give you what you need, or you step away. It's just not, as bad as it was, we can't sacrifice ourselves to make sure that we're taking care of our patients. Whenever I fly, I always say this. I love what Delta Airlines says. It's like your oxygen mask first. That should be for us as well. And so yeah, we have to take that part very seriously, to pour into to ourselves, so that we can be the best and most effective caregivers and physicians that we can be for our patients.
Because for far too long, we've been, pouring from this empty cup, right? We didn't have this platform where we, could connect with each other, and, and share, but then also get rejuvenated. And so that's why Hope for Med was created. It was so that we could have that place that's separate from our place of employment, where we can have these conversations. And I think these conversations are extremely important, because it just shows that we're human, and as humans we are fallible. It's true. And but as humans, we or as caregivers, we need to take care of patient number one.
Absolutely. I'm so glad you have this resource out there. I definitely know there's a mental health support shortage for my patients, but then when you look at the level of us as providers, behavioral health, mental health support is lacking for us as well. I mean, it's even more compounded. So whether or not the outlet is, one-on-one professional or group setting, or even just passively looking at things online, I think all of it is so important, just like you said, to say to someone else, hey, oh, this person's story is similar to mine. I didn't realize that maybe I could do these things as a way to kind of reduce the stress that I'm feeling or engage in more self-care. And so I think it's vital the role that your program, your product, Hope for Med, is doing. Absolutely vital.
Well, thank you. So could you share with my listener, what you engage in terms of planning your self-care?
I've gotten really good. My friends and family laugh at me because they'll be like, "Oh, where's Madeline now?" So pre-COVID, I had probably gotten to the place where, so I think I used the phrase earlier, my then husband. So after my divorce, I remember initially being concerned because when it came to custody, my sons were going to be, spending an equal amount of time, with me physically and also with their dad. And so at first I remember my heart being broken because, I wanted to have them around me all the time. That's what I was used to. Mm-hmm. But then what I began to realize that there was an opportunity when they were with their dad, when I could really begin to pour more into myself. And so that's what I started doing. If they were with their dad, I might schedule a trip to Dominican Republic for the weekend. Or maybe I'd go up to New York where my long-term ride or die friends all live still, and spend a weekend in New York and treat myself to Broadway and check on my mom and check on family. And so I began to be more intentional with my calendar and not just let things kind of happen randomly. So now let's fast forward to maybe sort of kind of getting past COVID. We don't know. I think it's going to be here to stay for a long time, but I am at least feeling more at peace with trying to plan more travel. We're just going to have to do it in this way that is part of the new normal, and do it as safely as possible. Vaccinated, boosted. I'm trying to figure out when I can get my 4th dose so I can stay as protected as possible. But yes, I'm very intentional. So that's when I do big stuff like travel. For me, travel is a huge part of self-care. Mm-hmm. I think there's really something enlightening and comforting to go to another place and share and engage with other people, other cultures, and just really, open oneself up to all there is to learn out there in this big, beautiful world of ours. But self-care for me is also, when 2021 started, I had written down that I was going to take an opportunity, at least, we have these showers and bathtubs. I was like, once per week, I'm going to sit in the bathtub and just soak. That's self-care for me, because I'm usually just rushing into the shower, trying to quickly, shower to start the day or end the day and go from there. So sitting with a bath is self-care. Sitting down with a good book, lighting a candle, and just having some time when the dog is not barking, or maybe, 2 of my sons one's graduated from college and the middle one's away at college. And so my 15-year-old teenagers really don't want as much to do with us. So finding moments when my teenager is busy doing some stuff with his friends or maybe doing some schoolwork, and when I'm not working, to fit in some self-care. It's also going to a movie solo. One of the things about me that I think is an important part of self-care, well, it helps that I'm an introvert by nature. Mm-hmm. So I have absolutely no problem with doing stuff alone. And sometimes when I'm talking with my patients, I say to them, because they'll say, "Oh, I wanted to do this, but my friend wasn't available. Oh, I wanted to do this, but my cousin had to work." And I'm like, "Girl, one of the most beautiful things you can do as part of self-care is figure out if you're comfortable with or getting comfortable with spending time just with you." There's something so empowering about that, just really having some time just with you and your thoughts or whatever you want to do with that time, to just, really be okay with being in your space, your own space. That is also self-care. And so those are some of the things I do. I also, I do an annual mom-son adventure trip with my sons, because for me, self-care is also making sure that they know that I expect them, even when they're no longer physically connected to, this home and under my roof, it's important that they know that self-care, for their self-care, I want them to unplug at least once a year, hopefully more, but unplug from everything and everybody and go away and do something that, you're not checking your phone every 3 minutes, and we get to visit other places and go to a beach and enjoy the beauty of this world that God has created. So So I have many facets of self-care.
Yeah. And I love it. I love it because you just highlighted something that's very, very key. There's different, amounts of planning that can be involved in self-care. There's these trips, and these trips is not something, maybe like a quick weekend getaway. Yeah, that could be a last minute thing, but sometimes you have to actually plan that out. But there's also smaller things like taking a bath, like reading a book with the candle, all those smaller things that are very, very practical, but that take some intention. Right. You have to plan it, like you plan your baths once a week, because if you don't really plan it, then it's very easy for it not to become a reality.
Absolutely. Absolutely. Oh, and I forgot to mention a big thing. I had not done therapy for many, many years. And around maybe end of 2019, I remember reaching out to a therapist that I had been speaking with a few years before. And I said, you know what? I've been thinking of this wrong. I've been thinking that, oh, when something bad happens, let me go find a therapist and talk with them. I said, you know what? I need to do some preventive work. I need to talk to you, like whether it's every couple of weeks or monthly or something, because there's a lot going on. And I think, every now and then to help me not slip, I think if I have some groundwork already in place, that would be helpful too. So I forgot to add that to the list as well. Therapy is self-care as well.
And with that prevention, that kind of goes down your path of public health, right?
Exactly. Exactly.
And medicine, medicine really, I strongly believe that we should have more of an emphasis on prevention. And so that's really, really key, especially when we talk about things like burnout in medicine and healthcare. It starts early, and we need to come up with interventions early. We think about the students, the health professional students coming into this field. What tools can we equip them with so that hopefully they never experience burnout, right? So hopefully, they can go through this career loving what they do, right? Choosing a career path that really aligns with their core values, figuring out what their core value is, and staying connected to that core value so that everything that they decide to do aligns with that throughout their career.
Absolutely, I agree with you 100%. And the other thing that's important for early career docs to know is that it's okay to change and evolve. Exactly. When I left residency, residency is like this 120-hour a week grind, pre-Bell Commission. And, I got to CDC, and it was definitely a transition because I was in front of a computer and at a desk and crunching numbers and running analyses. But then that grind began to burn me out. But, you reach a point where you're like, oh my God, if I don't have 5 or 10 publications a year, I'm just not cutting the mustard. All this pressure. Now, the reality is that in certain academic and or government settings, that pressure is real because that's just the culture. But how do you begin to, unravel from all that pressure? And, that was one of the things that even though I was in love with what I was doing when I retired from CDC, it felt good to no longer have to be like, even though I enjoyed it, because there's something fulfilling about going through a process in which you have like a published product or, you successfully help someone navigate through something. But when you remove that pressure of feeling like that's the minimum of what you need to do, that is okay too. And so I would definitely say to the early career folks that, if you're loving something for a few years and then it shifts and you want to love something different, it's absolutely okay. It's okay. I think it's really good to kind of develop multiple skills so that when you need to pivot, you just go kind of, okay, I've done that. I love that, but now let me go do this.
Yep. But in order for you to really be able to do that and know when it's time for you to pivot, you have to stay connected with yourself, right? And so part of staying connected with yourself is what we're talking about in terms of really getting that time alone to think, to process, and, being very intentional about it.
Absolutely. I agree 100%.
So, with that being said, if my audience wanted to find out more about what you're doing and get in touch with you, how could they do so?
Sure. So one of the things I did after I retired from CDC is that I developed kind of like this platform. My social media platform is Dr. Madeline ND. And I invite anyone to kind of follow me on that platform, inbox me questions. So it's Dr. Madeline MD. It's DrMadeLinemD. And that is my tag on Instagram, on Facebook, on Twitter, and YouTube. And so absolutely, I welcome, all questions, all followers. I love to try to collaborate, especially when people are in a space of health and wellness, especially for women and especially for sexual health. And so yeah, I'm excited. I'm working on another book. I wrote a book last year because one of the other things I'm passionate about is helping make sure women know everything there is to know about birth control, because we just don't know where things are going to go in terms of access. And so, that book I wrote last year, In Control, and I'm working on one now to help more perimenopausal women. And so, I'm excited. But yes, Dr. Madeline MD, to find out more info about those things and keep in touch and follow me in those ways.
Well, you're doing amazing work. I'm so happy.
Thank you. And so are you, doing amazing work. In Florida, right?
Yeah, in Florida. So in closing, do you have any words of wisdom or advice for my audience member?
I would say this: medicine is interesting for a lot of people for a lot of different reasons right now. I want to encourage anyone who happens to see this podcast that it absolutely is worth it. It can get better. It's absolutely what you put into it, you can get out of it. And I think what's important to know is that identifying mentors and resources can save you from drowning or feeling overwhelmed, or helping to find out how to navigate through something that's a challenge. So I would encourage you to hang in there, to make sure you have an outlet, whether it's through an online resource or services like Hope for Med, or a human being that's in your world, or just anything to help make sure you can navigate and get what you need. And for those who might be watching who are within the realm of persons of color, Black, Hispanic, Indigenous persons, absolutely, it's important that you find a tribe. And some of the spaces in medicine that we might find ourselves in don't have a lot of people who look like us. And I found in the years that I've been doing this work is that we, people of color, tend to get more disheartened for a variety of reasons that are valid. And so one of the things that has absolutely helped me, I want you to not be shy about identifying a mentor, even if it's an informal person, and going up to that person and saying, hey, I just need a little bit of help. I'm not officially asking for this amount of your time or something like that, but can I just talk with you for a few minutes? Or can I schedule some time to bring coffee to your office, or meet you in the cafeteria, or go grab lunch? I think it's extra important for us. As Black women, we are 3% or less of all the physicians in this country, in the United States. And so I think Black men is 2%. And so again, just really, it's important to kind of find your tribe, or at least one person, and don't give up. Know that there are different things you can do, different ways you can explore what you want to do, and welcome to this lovely world of medicine, and helping people, and helping health disparities, helping to get people where they need to go to be healthier and well.
This is Hope for Med, new day for Med, for us, by us, and just for us. This is Hope for Med.